welcome you tonight. I'm Lisa Dunbar. I'm the Director of Nursing here at Christian Care's Senior Care Community. And we'd like to welcome you to our educational series, Navigating the Journey of Aging, and what a journey it is. Tonight, we're very pleased to have a speaker. This is Leslie Wooldridge, who is a geriatric nurse practitioner. She's the director of the Adult Bladder Control Center at Mercy Health Partners at the Lakes in Muskegon, Michigan, and also is the owner of Diversified Nurse Consulting. She has over 29 years of practice as an advanced practice nurse, and geriatrics and urology have always been her specialty for the last 20 years. So we are very privileged to have her come and speak to our community about some of the problems with bladder control and incontinence and how to prevent them. Leslie?
Thanks, Lisa. Good evening, everybody. Thank you for inviting me. You know, preventing incontinence is one of the most important things that we as adults can do, whether you're male or female. And there's a big misconception that it's always only women who can leak as they get older, but men can have the problem as well. One of the things that happens is, as we get older, there are several changes that take place in our body. And I think it's important to just kind of understand those changes that might contribute to leaking urine or urgency or frequency or any of those bladder problems that can cause lots of frustration and problems with everyday living. One of the first things is that our muscles tend to not really contract as well as they always have. So what happens then is your bladder doesn't always empty unless you're very patient. And most of us are not patient. We go to the bathroom, we pull our pants down, we do what we have to do, we wipe ourselves as we're pulling our pants up, and we're off. And as we get older, we really can't do that anymore. We really have to take our time, we have to allow our muscles to work, we have to allow our brain to work, and all of those things so that our bladder will work properly. So that's one thing. One of the other things that happens is that our bladder has what we call contractions that just happen, so that your bladder would contract at any time that would give you the feeling that you have to urinate, and we call that urgency. So, you know, if you have uncontrollable contractions, you might have lots and lots of urgency, but normally we would have just a little bit of urgency, and that can happen. So that's the second thing that happens. The other thing that happens is, as women get older, we lose estrogen. And as we go through menopause, or when we are what we call perimenopausal, around the menopause period, what happens is that the estrogen in our vaginal area, in our bladder, becomes depleted. Because we have what we call estrogen receptors in our bladder that stores the urine, in our urethra, where we urinate out of, and in our pelvic floor muscles. And those areas are vital to being able to urinate properly. And so when we lose estrogen, sometimes we have urgency, frequency, or we have leaking, because those things affect everything. Sometimes just a little dab of estrogen cream in that area will help that problem, and women get better quite frequently and nice and easily. Now, men, on the other hand, their prostates enlarge. Now, if you know your anatomy, your bladder's right here, so your bladder's like a balloon. When it's deflated, it's only about this big. So it's only about the size of a quarter or a $50. As it inflates, and most of us can hold at least a cup and sometimes 2 cups. As we get older, again, our bladder's not going to hold as much. So what happens is it's a balloon there. Now, in the man, down here is the urethra. Well, in the woman too, the urethra comes straight out of the bottom of the bladder. But in the man, there are two little pouches. They're like chestnuts on either side of the base of the bladder. So you've got your bladder here, you've got your urethra here, and right here are 2 things that we call the prostate gland. Now, in every single man, the prostate will enlarge at some point in their life. We usually say that around the sixth decade that the prostate starts enlarging and starts giving men problems. For some, it's much earlier, can be the 4th decade, and sometimes even the 3rd decade. For some men, it's never a problem until they become in their late 80s, 90s, and 100. But every man's prostate will enlarge. Now, an enlarged prostate does not mean that a man has cancer. We call that benign prostatic hypertrophy. And so that's when the prostate enlarges normally. And what happens is it kind of enlarges and it kind of suffocates that urethra so that it's hard to get the urine out. So in that case, men will have difficulty starting their stream. They'll start their stop, they'll start their stop. We call that hesitancy. Or if their prostate becomes so enlarged, it becomes irritating to the bladder. And that irritation can cause what we call urgency. So they're going all the time. They feel like, I gotta go, I gotta go, I gotta go all the time. And when they get to the bathroom, they can't go, or they just pee a little bit. And it's very frustrating. The other thing that they notice is that they're getting up frequently at night. And that brings me to my next change that occurs in aging, is that we will tend to get up more at night. So getting up during the night once, even twice, is normal. As frustrating as that may seem, it is normal. And that's because one of the theories is that we lose a very important hormone as we get older, called the antidiuretic hormone, that is manufactured in the kidneys. And that helps prevent us from peeing all the time. So it's antidiuretic, and then some of you might take a diuretic that makes you go to the bathroom a lot. This is anti, so this keeps you from not going. This is a normal hormone that we all have in our bodies, and it regulates how much we go. So it's a very important hormone, but one of the theories is that that hormone's not very prevalent anymore. And it's just that the kidneys manufacture more urine at night. It's just the way it is, unfortunately. And so one of the things that I encourage my patients to do is don't drink before you go to bed. Stop drinking a minimum of 3 hours before you go to bed, but if you can stop drinking after supper, that's even better. And make sure when you go to the bathroom at night, the last time before you go, that you're in there, that you're taking your time. Okay?